Okay, Dr. Morse, out of respect for people being prompt, let's go ahead and get started. I'll just say hi, welcome everybody. Marcus Cheatham from the Mid-Michigan District Health Department. You are here because the state of Michigan instructed to work with you, work with your local health department on plans for reopening schools. Let's be honest, your local health department is no more of an expert, in fact, is almost certainly less of an expert at that than you are, because you really know about education. Dr. Morris knows, as a clinician, she knows something about communicable disease, and so we're trying our best to help you with those plans, but I think that you'll find you benefit as much from the discussion with each other on this call as you do from talking with local public health. So with that, Dr. Morse, let's just go ahead and jump in.
Okay. Well, thanks for joining us. After this talk, at some point, you will get a very long version of this PowerPoint sent to you, which is extremely inclusive of information with links to other resources. Today, I'm going to give a shortened down version of that just as a jumping point for discussion. We did receive some questions as well prior to this, and then we can cover those. And I want to go through this pretty rapidly so that we have plenty of time at the end for questions, knowing that there are questions we can't answer because some of it has to do with what rules you need to follow and other legal issues with schools that, like Marcus said, we just don't know. So again, I'm going to go through this quickly, knowing that you are going to get much more detail from us very soon that you can use as a reference. And I want to leave plenty of time for questions and answers at the end. But this is going to help us as a starting point and hopefully answer some of your questions from the get-go. So one thing I really want to recommend, and I think may have already been recommended to some, if not all of you, there is a guide about 63 pages long from Harvard and other resources that is phenomenal. I really recommend it to all of you and anyone in your schools to read through. It's a very quick, easy read, but it really explains why we're recommending the things we are, why you should consider doing things, even if they're not necessarily required. But it's just a great resource about how to keep your students, staff, everyone in the building healthy this year. So the My Safe School roadmap and the executive order that really gives the teeth behind it are a big part of why we're here today. So you know that you need to make a preparedness plan with procedures and policies that address whether you're in phases 1 through 3, phase 4, or phase 5. You have to get that to your school board. You have to get that to the state. You have to get that on your public internet site. If you don't do that, you can't open. But as far as we know, there's no other policing or punishment or monitoring of how well you're able to enforce all these policies, which is good because realistically, no matter how good your intentions are, it's going to be challenging to make kids do everything they need to do and to keep all these things going as they should. So basically, you need to have plans to do what you need to do. But as far as we know, no one's going to come by and write you tickets or cite you for not doing the things or not being able to force children to do the things that they should be doing. So in terms of the regions, the state has been broken into 8 regions, primarily for economic planning. But the map is what the map is. It's available at mystartmap.info. There are 6 different phases, all the way from 1 where there's just uncontrolled growth of the virus. Hospitals are overloaded. We can't keep up with it. To 6, which is post-pandemic. Every case is a catastrophe because we thought we had it under control. The state really determines what phases we're in, and they look at how many lab confirmed cases there are, how many deaths there are, what % positive are we seeing when lab tests are being done, are there enough tests being done, and just other epidemiologic information in general. So right now, if you look at that website, this is the map that you see, and it's a very scary map. But if you read the print under it, it says, this is the epidemiology right now. This is not the map that they use for economic engagement, meaning obviously if we followed this map, we'd all be staying at home again. And it says you can find that resource if you click here. Well, if you click here, it takes you right back to this same map again. So it's very, very frustrating. And I have shared emails with the people that make this map and with the state saying, where is the information we need to know what schools have to do? And they're working on it. So I asked yesterday when that will be available and where will it be available, and I have yet to hear back. So just know that this is not the phases you'll be following, because again, for all of you, I think, you would not be going back to school in person if this was the map you'd follow. So again, don't panic, but we're trying to figure out how they're going to communicate that to you. But in the meantime, the way that you can kind of follow the trends that your area is following, if you go to mystartmap.info, and hopefully this same data will be available for how they determine the schools as well. If you hit the drop down, well, if you click on your region, the counties will show up down here, but if you click on the region, it'll show your data for your region. If you click on the drop down arrow, it'll show different indicators, and you'll be able to see where the thresholds are that they decide, is this high, medium, high, is this basically phase 1, phase 2, things like that. And you can see, oh, Marcus, I just got a message that someone is waiting to join the meeting. Can you let him in? Sorry. And you can
I don't see them, Dr. Morse.
Okay. Let me see if I can. Yeah, I don't know if Cindy can help us or not. But if you click on your county, you'll be able to see these same indicators at a county level as well. So again, if you want to see, gosh, are we creeping up or down towards different phases, this is a good place for you to go. Now, COVID and kids. All we really know about right now are what happens in families, because we know, when we're staying at home with our families, how does it transmit in those household settings where really the highest risk of spread is, because people are closest together. But in household settings where someone in the house is sick, kids do appear less susceptible to infection. They're about half as likely to get sick than adults are when they're exposed in a household setting. And usually they're less sick than adults, but kids with comorbidities like heart disease, lung disease, other things such as that, are at higher risk than their healthier counterparts to get severe illness. It tends to take a longer time for kids to get sick after exposure. If kids and adults are exposed, it usually takes about 5.5 days for an adult to get sick or have symptoms, and it's about 7.5 days for kids to get symptoms. The longest is up to 14 days, which is not typical, but it can happen. And that's why if someone is exposed, we have to quarantine them for 14 days to make sure that they don't get symptomatic. Infected kids do display similar symptoms to adults, but different ones tend to predominate. They tend to have more sinus symptoms and less constitutional symptoms. So those are things like headache, fatigue, things like that. So these were 2 studies that have come out recently looking at huge numbers of kids and adults. One thing you'll notice is that fever is not present in everybody. So the lack of a fever does not rule out illness. Cough is common in the majority of people. So fever and cough are the most common, but still not seen in everybody. But I'm so sorry. But runny nose and congestion is more common in kiddos, but adults will have more muscle aches, fatigue, headache, and I believe, yeah, adults tend to have just more symptoms in general. So kids are just less likely to have a lot of symptoms. So a big take home from all of this is just to remember that your adult staff, your coaches, volunteers, which really you shouldn't have many right now, but they're the biggest risk to get sick, to spread it, to be really sick from it, and to end up dying from COVID. So when you're looking at prevention and who's really at risk, think about those individuals and what you need to do to help keep them healthy. So masking, I know masking is irritating. I know we're all sick of it. I know it's a frustration, but it really should be part of everyday life now and for a long time. I hate to say it, but this is going to be around for quite a long time. You know, the vast majority of us are going to have to be immune to this before COVID goes away. So we just kind of have to come to terms with this. So everyone that is able should wear a face covering as often as possible. Realistically, this is going to be a challenge. You're going to have to do the best you can do. You're going to have to focus on the highest risk settings, which are situations where people can't keep far enough apart from each other, or times where the voice is going to be really projected. As much as you can, and as much as is allowed by the rules, try to allow breaks from masks. You know, get single classrooms outside even for 5 or 10 minutes and have them spread out across a wide area and take their masks off for 5 or 10 minutes and just let them holler and, you know, call it a mask break, and just whatever you can do to help people to not lose their minds over all of this. So again, there's definitely going to be challenges that you need to think through and come to an agreement how you're going to handle it. Who's going to wash these? We know that it's going to be a challenge to get families to wash these. The recommendation is to wash them every day. Frequent washing does break them down faster. So kind of think about the balance there. Are kids going to bring these back and forth to school? Will parents willingly send them to school? Will you have some that kind of try to sabotage the system because they're not really buying into this whole idea? Where are you going to get extras if kids don't remember to bring them to school? If they get worn and are tearing, will you have extras to replace it for them? How are you going to address the claims that they medically can't tolerate a mask? And we'll talk about that more in a minute. What are you going to do when you have kids, especially, you know, a teenager or a faculty member who just says, I am not going to wear that and you can't make me? So I know I've had some questions come up about concerns with safety. You know, is it safe to have a kid wear a mask all day long? So there have actually been numerous studies done on healthcare providers who've had to wear masks for 12 or more hours, you know, especially in like desert settings and much more restrictive masks. And there's really not been adverse effects such as high carbon dioxide levels or low oxygen levels, mainly just comfort. And the longer you wear them, the more you start touching your face and adjusting them. So that's why it's good to try to have some breaks from them. They're not recommended for really young children, like those under 2, just because they may not have the mental capacity to know to take it off if it is rubbing them wrong or if it is maybe too tight. The biggest issue is if it's too thick and it's hard to breathe through. Those are the issues with especially the fabric masks. There is an alternative if you can't tolerate a mask, which could be a face shield, and we'll talk more about that in a minute. So teachers are a risk because they're standing in front of everybody talking loudly and really projecting their respiratory droplets out to everybody in the classroom. But a concern certainly could be, you know, understanding of what they're saying. And, you know, especially with little kids, is it going to be a difficult thing for them to understand what they're saying? So an option could be a clear mask. So this is not an endorsement in any way, but there are some different commercial clear masks available, which I show one image here. They're disposable. You're not supposed to reuse them, but that's in the healthcare setting because you're working supposedly with people that could be ill. So they could be contaminating the outside of your mask and you should dispose them. In the school setting, you could reuse them theoretically, and I'll give instructions later on for ways you could clean them. There are many different instructions online for how to sew or make clear masks, and here's just one example. The less preferred option are face shields. Face shields are not addressed in the roadmap. It says face covering. And I have heard from one superintendent that there was a legal opinion given that face shields do not comply with the roadmap. So again, from a public health standpoint, if you have people that cannot tolerate a face mask medically, they often can tolerate a face shield, and it's better than nothing. It's not as good as a face mask. But again, that's going to be a discussion you need to have to see if it does comply with the roadmap. Again, I'm not aware that you're really going to have people coming and monitoring that you're following all the rules in the roadmap, but that is just something that, again, per public health, that is a acceptable second option to face masking, but you'll need to see if that does comply with the rules you are required to follow. So you really should have students wear masks as much as possible while there is spread of the illness, whether you're phase 4 or phase 5. I know one has it required, one has it strongly recommended, but they're especially important when you have students mixing together from different classes, like in hallways and bathrooms. Younger kids will have more of a struggle with this. They'll be touching them more, moving around more. So it's really important when they're not in their cohort of classmates, when they're in hallways and public areas, that they really focus on those times. You'll want to work on training everyone on how to properly wear them and care for them. And you may want to consider providing time and resources so students can wash their masks at school, have an extra one at school that they can swap out, because again, it may be a real challenge to have that getting done at home. So again, just some considerations. For those adults and kids that are unable to wear masks, you need to decide what your policy is going to be on that. I will say that there are no hard and fast medical reasons someone cannot wear a mask. Most can adjust to it and get used to it and find a mask they can tolerate. There are some, especially claustrophobia or post-traumatic stress disorder and some like that, that really do struggle to wear them. Doctors right now are getting bombarded with requests from people to write them a note, giving them an excuse to not wear a mask. There are some doctors who are just saying they will not give a note. So I would strongly encourage you to find a method that does not require a note from a doctor. However, when I suggested this to another group of superintendents, that was very difficult for them to wrap their heads around, because again, then you come up against, will that then lead to everyone saying they have a medical exemption? So I completely understand the challenge with this. I've had one colleague who has said, well, maybe we should just not let kids come to school if they don't wear a mask. Well, that has a challenge with it too. So again, this is not an easy thing to answer. I honestly don't know the right answer to this, but I will just say that requiring a note from a doctor is not going to be an easy answer, because I do know of doctors that are not writing them, and I do know that you will not get them back quickly. So I just put that warning out there. Again, I mentioned that clear face shields may be an alternative for people who can't tolerate masks, or again, if communication is a concern, especially if you have individuals who might be handicapped or have difficulty removing things from their face, and you're concerned about safety issues, a face shield may be a good alternative. So, but again, we can't really comment if that fulfills the requirement of the roadmap. Most face shields are disposable. You're supposed to only use them once, again, like that clear face mask. But the CDC actually does provide some cleaning suggestions for disposable face shields for times where healthcare has critical shortages of their PPE. And so I did include a copy and paste of those cleaning suggestions. So again, since you're not dealing with contagious patients, the risk of contamination is quite low. And so you should be able to clean these reusable items and use them again safely. We acknowledge the confusion with the masking rules right now. Executive Order 147, the new masking order, says that if you go into any indoor public space, you have to wear a mask. No ifs, ands, or buts to that. Your roadmap says that if you're in phase 4, all the staff needs to wear a mask except when they're eating. And then students, of certain grade levels have to do the same with no exceptions. The Executive Order 145 for workplaces says you have to wear a face covering unless you can stay 6 feet apart. So we understand that there's very much a disagreement between some of these orders. We're not quite sure which one trumps which one. And so we're hoping for clarification. And again, that would be something, talking with the Michigan Department of Education to see if they can clarify what rule trumps all for you, because at this point, the fear would be that despite what the roadmap says, every single person in your school would have to wear a mask all the time because of Executive Order 147. I don't think that's the intention, because the roadmap says something different. So, I apologize that we don't know the answer to that either, but we're all just as confused as you are with that. Screening of students. In terms of testing, I know we've gotten some questions about, should we test all of our students and staff for the virus? Should we test all of our sports or our athletes before starting sports? Uniform testing of everyone who's asymptomatic is not recommended. The test can have a high false negativity rate in times like that. It's really just a snapshot in time. So it just means that you may be negative at that 1 second, but you could leave the testing site and get infected on your way out the door. It's very time consuming, very expensive. So it really, it doesn't help in the long term. So it's really not considered a useful thing to do. People that are symptomatic should definitely be tested. Contacts to those who are infected are recommended to get tested, but just broad testing of everyone is not encouraged. For screening of students coming to school, it is recommended that all students be screened for signs and symptoms of illness before coming to school. You can choose to screen them individually as they get to school. It is acknowledged that that is a very big disruption to your school day. The amount of time that would take would be extreme, and it would be very disruptive to the school day. So many organizations acknowledge that is not necessary, and again, would take up a lot of your school day. So we know that the health department is asked to help consult with you on this matter. So we do recommend, and it is ordered in the executive order, that you do have a screening tool for your staff, and that's a separate thing we'll talk about in a minute. But for your students, you are allowed to have the parents screen them prior to sending them to school to expedite the school day. Again, you can do things more stringently. You can screen them, coming into class, coming into the building. However, you can have parents report electronically before they leave. That, however, may be an issue on itself, that parents may not have the technology to do that. That you may have parents that don't do it, and then you have to hunt down the child and the parent and see, do they have symptoms or not. Another method you can do, and that we feel would be the easiest, although we recognize you're going to miss some this way as well, is just providing the parents with education about how to screen their child, what to watch for, and what to do if they are symptomatic, and give them some kind of a visual trigger that they can, hang by the door that they leave from every day or something, so that they remember to screen their child. We know that parents send sick kids to school every day anyways, so we know that this is not perfect. But again, we do offer this as an option. So an example for material you could put on one of these cards or magnets or whatever you choose to for a parent would be to have them, prior to sending their child to school, would be to see if their child feels feverish or has a temperature over 100.4, to screen their child or see if their child has any of the following symptoms, to think if their child has had any close contact with someone diagnosed with COVID, if since the last day of school the child has been diagnosed with COVID, and if they answer yes to any of those questions, they need to keep the child home, call the school and let them know why the child is staying home, call their healthcare provider right away, and then resources for finding a testing location for COVID. If someone at school gets sick, we do recommend that teachers, bus drivers, others at the school do continuously watch children for signs of illness, and then know what to do if that occurs. Anyone with symptoms or signs, adult or child, should have a mask put on right away if they're not wearing one, if they're able to. Ideally, a surgical mask is more effective at preventing germs from leaving a person. If they have a cloth mask on already, don't remove it because that just, lets the germs out. We want to get them away from everybody else as soon as possible. You're not required to have a quarantine area, but it is strongly recommended that you have a place where you can separate those that have symptoms of COVID away from everyone else. Knowing that you may have several of these children each day, it's kind of hard to know at this point. It is best to try to keep all the sick children separated from each other, because if one ends up having COVID and the rest did not, now all those children have been exposed to COVID. But completely understand that you don't have a bunch of empty rooms sitting around that you can quarantine children in. So do the best you can. If you can find a room with a window in it so you can open the window, that's ideal as well. But do the best that you can. One of the references I have at the end of this presentation is for the National School Nurse Association, and it lists the recommended PPE for nurses or staff working with children or others that are suspected of having COVID. So that is there for you. So if someone gets sick, if someone is highly suspected of or confirmed of having COVID, we recognize you need to follow FERPA, we need to follow HIPAA. So, your main staff that help us with these situations typically know who the student is. So usually your school nurse or your secretary, but we can't tell the whole school who is sick. But somebody at the school will help us to identify who that person was in close contact with, starting 48 hours before their symptoms started. And if they're not symptomatic, then it's 48 hours before their test was done. And then close contacts need to be in quarantine for 14 days after they were last exposed to that person. We get questions still about contacts to contacts. So if one of the classmates was a close contact to someone with COVID and that classmate was on the football team, does the football team all need to be in quarantine? No, they don't, because the close contacts are not infected at this point. We're just watching them to see if they do get sick. And that risk is anywhere from 0.5% to 15%. The highest risk are in household members. So again, contacts of contacts do not need to do anything special. So some resources say that everybody within a classroom is a contact and needs to be on quarantine. Realistically, we will look on it at a case-by-case basis. If everyone's wearing face coverings, there's sufficient distancing between students, or at least some distancing between students. Students sat in assigned seating, and we were able to identify who is closest to that ill student. The ill student, was not coughing and sneezing for several days while contagious without a mask on, things like that. We may be able to look kind of at that closest ring of students around the ill person and only quarantine that group. So unfortunately, there is no black and white that will say if someone gets sick, then these people will have to be on quarantine. So we will work with your staff to figure out who's going to need to be on quarantine. And I'm trying to work on a tool to help with that as much as possible, because I know it's going to be challenging. This is why it really is recommended that you try to cohort people as much as possible. I know that's really difficult in the high schools, but as much as possible, if you have groups of kids that tend to take the same core classes, if you can keep them in the same classrooms together as much as possible throughout the day, then, if they get sick, hopefully only 40 or 50 kids will need to be on quarantine instead of 180 kids. I know that sounds awful, but it's the reality of it. We have to think about other close contacts to them as well. Like, are they in Boy Scouts? Do they go to a Bible study? And so as you communicate with parents about things and educate them, you may want to encourage them to keep a log or a calendar of everywhere that they're going, so that if we do have to look for close contacts, it's a lot easier for everybody to find them. So again, close contacts will need to be quarantined. We will communicate with them, we will monitor them, but these are times where you'll want to have remote learning options available, because they'll be home for 2 weeks, they'll be perfectly healthy, they'll be able to learn. You shouldn't have to need to count them as sick, because they should be able to continue with their studies if those tools are available for them. Teachers very well may need to go on quarantine as well, both for school exposures and family exposures, because they may have spouses that are getting sick at work and coming home and exposing them. So be prepared for backup education staff. Identify them early if you can. I know this is really difficult, but that way you can have them trained on your COVID policies and procedures, so it's a lot easier to bring in somebody. We know if you have a COVID case in a classroom and we identify the close contacts, we know that every other parent with a child in that school is going to be worried. So we'll work with you to get out a letter to the families explaining that all the close contacts have been identified and on quarantine, and that your student has not been in close contact. However, make sure and monitor them for symptoms so that we can hopefully not have any panic in the school system. So just a little refresher about close contacts. The 6 feet apart for 15 minutes is really kind of ingrained into our brain now, but it's not just that, it's the intensity of our exposures, the frequency of our exposures, and the duration. So if you're in a classroom for 6 hours every day with somebody breathing recirculated air, and they're contagious for 4 days, that's an exposure. It doesn't matter where you are in that room. So I put this illustration here. This was from a case. The yellow A1 person was the index case, so it was the one infectious person in a restaurant during an 1.5 hour long dinner. And then all the other red people got sick, and they blame it on the air conditioning, which you can kind of see those arrows as to where the air conditioning was blowing and recirculating. So again, it's not just the people that sit next to you necessarily, there's other factors. So we do get some interesting discussions with people saying, well, I wasn't 6 feet away from them. Well, there are other factors that can play into it. So I just want to point that out as we look at contacts and quarantine, that there's other things. The health of someone too can make them at greater risk for infection as well. So if someone is sick, if they're symptomatic, they have to stay home until they have had 3 days without a fever and with improving symptoms, and it has been at least 10 days since they first started having symptoms. If they were tested and they were positive, but they never had symptoms, they have to be in isolation until it has been 10 days from the date of their test. So again, for those individuals who are on quarantine from a sick family member, or if they are sick but not that sick, or they're asymptomatic, to have remote learning options available. There may be times where the school has to close. When we have a second wave, which right now we're not in a second wave, the first wave never ended, unfortunately, but hopefully schools won't have to close, because it doesn't look like kids are really responsible for that much spread of COVID like they are for influenza, but we'll have to wait and see. But if you're seeing large outbreaks within your school and you're seeing huge numbers of absentees and it's affecting learning, like when we have to close for influenza outbreaks, the school may have to close, and that would be a decision that we would make jointly. We wouldn't expect you to make that decision on your own. But usually you close for an incubation period. So that would be 14 days right now, but we may be able to make it shorter. And that's something that we're not really sure of right this second because it hasn't happened yet. And we should have further guidance from the CDC. The old CDC guidance back when this was first starting was if there's one case, you have to close down. That no longer stands. If you look at your phase 6 guidelines, that is the recommendation essentially, but that's because you would have no cases and one case would be a big deal again. So again, things are going to be fluid, but right now, my suspicion would be that if you have a huge outbreak and 30% of your students are sick and cannot learn remotely, you may have to close for about 7 days. So for staff wellness, there are resources. I threw the travel link in there because we do get questions about people traveling. Right now, the only people that have to quarantine after travel are those that travel internationally, unless you want to set your own guidelines. But realistically, travel within Michigan is just as hazardous as any other domestic travel. Our health department has a toolkit which has a screener you can use for employees, but you do have to follow the executive order 145, which replaced executive order 114, section 1 of that order. And this is just a synopsis of what that requires. One thing is that you do have to screen your employees, and it allows for a self-screening. So you either have to have them, do a questionnaire, or you can do a remote, like text them and have them reply to a text or something to just confirm that they do not have symptoms of COVID. Cleaning, I have a lot more information on this in the other PowerPoint that I will share, but just basic, because these are questions I get quite a bit. If you have cleaning products that are not on the EPA list N, you can look at the label, see that it is an EPA registered product. It'll have a number on there, and see that in the pathogens it says it's active against, that it lists human coronavirus. And then follow the directions for use, because if it's not used properly, like the surface is not left wet long enough, it's not going to work. The CDC guidelines for cleaning your organization are the guidelines that are recommended. The American Academy of Pediatrics does have some suggestions of using hydrogen peroxide, ethanol, or citric acid just because they're less toxic to children. But really what you have is likely going to be good enough. Other information on many other topics are included in the other PowerPoint that I'll be sharing. Work to educate your staff, your teachers, students, parents about all of this so that they know what's coming. Don't sugarcoat it. I mean, this is going to be very different, very challenging. You may have to learn from home for a while, but it's something we all just have to work through together. And then here are some resources. I'm working on many, many, many more resources. I did include in here some tips on like wheelchair safety, special education, other things like that, because I know that's been really lacking so far. The other thing I forgot to include it in the main PowerPoint, but the other big challenge we'll have this year is when flu season hits, because it's hard to tell the flu from COVID, and it's going to be really challenging. So do everything you can to promote influenza vaccination in your staff and students. Consider having flu vaccination clinics at your school. We may be able to help you out with that depending on what our resources are like given COVID at the time. I know a lot of pharmacies have done that for schools, but feel free to contact us if you're interested. I know I did have some questions here from you ahead of time. One of them was Clorox wipes and a bleach ratio that is effective for cleaning. Clorox wipes, believe it or not, do not have bleach in them. It's an ammonia compound, but they actually are effective against coronavirus. But if you want to make a bleached solution, it's 5 tablespoons of bleach per gallon, and that is in those CDC guidelines for cleaning. It's not recommended to use bleach solutions while kids are in the classroom because the vapors are hard on the lungs.
Dr. Morse, we are not seeing your Word file. We're still seeing the PowerPoint.
Okay. It's really just typed words. It's not terribly exciting. Let me. There we go. How's that?
Yeah.
Okay, and I am working on a master Q&A. I have like 14 pages of questions and answers compiled already from all the schools that I work with, because I work with 3 different health departments. So as soon as that's done, I plan to share that with everybody. But I just wanted to make sure I answered your guys' questions. So if a student has to quarantine for 14 days, do the rest of the classmates and their siblings have to as well? And so again, only if we determine that they're close contacts, and so that's case by case. When it states in the roadmap, face masks must be worn, plastic face shields, again, we consider them okay if they can't tolerate a face mask, but work with your legal counsel to see if they comply with the order. Is testing free? Most testing sites will bill insurance, and if you don't have insurance, they will bill the CARES Act. So for pretty much everybody, it should be no cost. There are some free testing sites. If you go to michigan.gov/coronavirus test, there's a way to search for testing sites, and you can click different filters, and one is to click for free. And so you can look for free testing sites that way, or you can also call 211 and they will help you find testing sites as well. How can you tell between allergies, cold, flu, COVID? It's hard. And so I'm trying to come up with some guidance for schools, basically to help you figure out when you send a kiddo home with the sniffles or a fever, when can you let them back? I mean, if we make every kiddo with a runny nose or a fever get a COVID test, it's going to be ridiculous. If you make every one of them stay home for 10 days, it's going to be ridiculous. So I've emailed someone at the state, and I'm trying to look at other states' guidelines and country guidelines on what is going to be best for you guys, because that is a really difficult question to answer. So training our staff on, so the CDC, and I know you can't really utilize these links how they are, but the CDC has posters and videos on training for hand washing and other components of COVID, but I'll try to pull together others. And then for band and choir and physical education, phys ed is covered pretty well in that Harvard resource I mentioned. The national, what is the abbreviation? NFHS, I'm blanking on what that stands for. But I was searching for guidance for bands, and they have a ton of excellent resources for all performing arts, everything. So they have all your sports resources, but they have tons of things on performing arts, how to clean your instruments properly, how to do marching band, how to do debate, everything. And so I'm going to be including that in the resources list. But that was really a jackpot. And so I got some additional questions. If a student is symptomatic, can we require a COVID test? I'm not sure if you can force someone to have a medical test or not. So that's something that you might have to talk to your legal counsel about, or the Department of Education. And I'm working on the guidance to when they can return. yes, you can get fit tested, and you should, because you should have an N95. Whichever occupational health clinic you send your employees to, like if they were injured, it's usually your local urgent care. They should be able to do fit testing for you. If not, they can send you somewhere. The McLaren Occupational Clinic in Mount Pleasant does that. So that is an option if you're looking for that. So that, and then these questions are, these I already answered. So if my spouse tests positive, but I'm a contact, you don't need to let everybody you've been exposed to yet, because again, contacts of contacts don't need any special treatment. So those were all the questions I got from people that were to be in this meeting. And we have 15 minutes left at least, so I am happy to take further questions.
So if you want to ask Dr. Morse a question, you can try raising your hand, although I can't see you all.
We could just take them off mute. I don't see a problem with that.
Yeah, so you can unmute yourself by moving your cursor, and then you see a bar pop up at the bottom, and you can click on your microphone icon and you'll be unmuted. Go ahead, I hear someone. Lance, you're unmuted. Did you want to ask a question?
Yeah, we're looking at opening for our educational center on August 5. That center is our most at risk in regards to students with compromised immune systems, and we're looking at opening in a remote setting for at least the month of August. Is this something that the health department would support in some type of written letter to us to help with our communication to families? And is that something that you're getting from other ISDs across the region?
We don't think you need a letter from us, but if it will help you with your communication, Lance, I would certainly be willing to write a letter for you. I think you're empowered to make those decisions yourself, but there are many times when organizations in the community will say, if the health department helped me out with a message here, it would make it go down easier for everybody else. So absolutely.
And can I just email you directly then?
You can, absolutely.
Thank you.
Someone sent in a message in the comments. What is the current situation with positive cases in our area, and do you feel it is safe to open schools at this time? We are seeing gradual increases in cases. Much of the state is. It's kind of challenging to say safe or unsafe, really. There's issues with not opening school as well. I think we all agree that the ability to teach was difficult remotely last spring. There's been reports that abuse and neglect to kids went up over that time period, and there's likely going to be increased high school dropout, and there's all kinds of different reports about the struggles from that and the benefits to getting kids back in school as well. It's a very difficult thing to answer, but most professional organizations feel that the benefits outweigh the risks, and so I think that's probably the best answer I can give.
If you want to ask a question and you're having trouble, you can raise your hand and I'll unmute you. Otherwise, move your cursor and the toolbar will pop up and you click on your microphone icon and you're unmuted. Okay, I'd like to ask you guys a question. I know that, oh, Shelley, did you have a question? Shelley Mills? We're not hearing you. This has got to be really hard for you because in Michigan you were given a skeletal framework and you're having to fill it all in yourself. I'm just interested in hearing about how that's going for you, how you're figuring out as a school district. So Linda Van Houten, you want to talk about Greenville? Because I think you're a really exemplary case of how schools should do this work.
Sure, Marcus, I'd be glad to. I'll be honest, it's very challenging. And I just sent a question about the social distancing. It's difficult to manage that with the number of staff that we have right now. It's going to, require additional staff, and with budgets being cut, that makes it even more difficult. So struggling with that. But we have been meeting with community members. Marcus has been very gracious at participating in our task force. Teachers, students are on our committee and trying to plan for the big picture, first identifying exactly what's our interest, and obviously safety our number one interest, but then identifying what are the other interests, and then problem solving some solutions that we know will directly meet those interests. Met with a group of teachers and administrators yesterday to problem solve. Not the question of when will students come back, but when they do come back, how do we accommodate them in a safe way? And so tried to get teachers to move past the when question, because obviously they have a lot of fear, and trying to say whenever it is, how do we do that in the safest way possible? So we are looking at that cohort piece really closely and trying to figure out how to keep cohorts of kids together, K-12. Meaning at the high school, we're going to limit kids passing in the hallway as much as possible by changing the whole schedule around at that point. Still working out those details. And again, still a real challenge. And I'll tell you, my biggest challenge is convincing teachers of coming back. Obviously, probably people are aware that in Detroit, when they started their summer school, teachers blocked the drive so that buses could not get out because they do not feel it's safe. There's a really popular letter from a teacher to the Ann Arbor Public Schools indicating that, if schools choose to come back, we're putting lives at danger and that we're literally killing our teachers. So it weighs heavy. I'll be honest about that. There's not a day that goes by that that's not the forefront of our minds. So it's difficult to process that and to maintain that positivity. I'd love to hear what other people are doing to help teachers feel more comfortable coming back to school.
Superintendent Amsterberg, how are you doing things in Gratiot, Ionia?
Gratiot, Isabella.
Excuse me, yeah.
We met yesterday and we talked about some different approaches, things. We were kind of waiting on this meeting today. I see Bill Chillman's on here, and we're waiting on some different direction from this meeting. This has been incredibly helpful, incredibly helpful. I think right now where we're at, and feel free other superintendents to comment, but we're basically looking at bringing folks back or an all virtual environment. I don't see a lot of support for like the 3-day, 2-day, things like that, alternate schedule with kids. So meet again Monday, and I think we'll fine tune it more from there, Marcus.
Good, thank you.
Regarding the social distancing, it is strong, according to the roadmap for phase 4, it's strongly recommended that you space desks apart 6 feet, and there's several other recommendations for distancing, but there's no requirements, I think, because they recognize that it's really difficult with how big your guys' class sizes have to be to do that. And that's why masking is required, because it's so hard to keep the spacing the way it needs to be.
Is it okay if I ask a question?
Please, is that John?
Yeah, Yep, John Dieter from DeWitt Schools.
What's the safety thing? What's more? Yeah, is it the flooding or is it COVID?
Sorry, I think one of the main questions that I get from staff and concerned people is what will happen if somebody is infected in the classrooms or in the schools. And I guess what I heard today was case by case basis.
Procedures.
I don't know that that's going to settle a lot of minds to say that. I don't know if there was any more guidance or anything more we could think about around that.
I can try to write up something more specific. It's really challenging because, you know, if you have a 5th grader who's taking his mask off all the time versus a 10th grader who's, it's just really difficult. And we get into this discussion a lot with people in the community who are ill, or who are contacts, and they're like, well, I wasn't, you know, I didn't do X, Y, or Z. It's like, well, but you saw them, or you rode in the car with them, or, you know, different situations, and it's very difficult. But I will try to come up with.
If you have anything going, you're welcome to sit and listen if you want.
I'll try to come up with something more specific.
The health department.
Some more examples.
I don't know if it's going to be any good or not. I mean, you don't have to if you don't want to, but.
Have we got more questions? I'd like to put Penny Dora on the spot, if you're willing to talk, Penny. About the Macomb ISD.
Sure. I think perhaps
she might have stepped away.
Is here. Is Kyle? Kyle's on the call. Kyle.
Yep.
I think we probably can both address any questions that you have, Marcus. I think that we really appreciate the work that you have done with us from the health department side, as far as providing information to us and answering our questions. That has been phenomenal for us to have your support. And I don't think that we can say thank you enough for the work that you've done with our districts.
So that is, I mean, a lot of us show up at the meetings, but it's really Dr. Morse. She's actually really helped to fill in a lot of the gaps in knowledge that we've identified at the state level. So.
We did in Montcalm County. We have done a bit of some campaigning as a collaborative superintendent group, and we put together a letter that went out to our local newspaper and was shared on a variety of our social media pages, just asking that our communities consider following those guidelines and precautions that the governor has requested as far as masking and social distancing, so that we might be able to lower and flatten the curve and lower our case numbers that would help us get back to school in a more suitable phase. So we did that in a letter, and that was published in our newspaper. Then we followed that up with a couple other components, trying to do more of a community awareness campaign. So we have a commercial that's out right now on our radio station. We have a local WGLM community radio station. So there's a commercial there asking for support from the community for the masking and social distancing to help us get our children back into the classroom. And then yesterday, we had our ISD superintendent and our associate superintendent of instruction. Those two went on the radio yesterday morning and had just a quick, maybe 20 minutes or so of a conversation with the radio DJ about things that we can do in our communities, kind of a very broad overview of the roadmap and what plans could look like, what the governor's laid out for everyone across the state. So those are some of the things that we have done to try and be proactive in the community with explaining and asking for some support so we can get our students back into the classroom.
Yeah, our purpose was really to shed a little light on how difficult this planning is going to be for the schools, and coming up with 3 different formats for students to come in. And it's really almost an impossible problem to solve. I know that I see quite often out and about that, some of our families are quite cavalier in terms of their unwillingness to wear masks. I walked into a store the other day and saw 20 people without a mask on, just counting them, before I saw somebody wearing a mask. And so our intentions on, going on spot on the radio was just simply saying, we want to be back in school. We want the kids there, and anything they can do to help abide by some of the recommendations would help us get there. So we tried to do that as delicately as possible. But I know that, we have a local ISD SOUP meeting here right after this meeting, and we have a lot of concerns on, trying to make our staff comfortable coming back. And, even here at the ISD, we have folks who have very serious health conditions that we're trying to accommodate. It's I don't know, it's quite cumbersome and challenging.
If any superintendents are interested in seeing the letter or the commercial that we used, I'll be happy to send that to, maybe if I send it to Jan and to, I think I saw Wayne Petroli here, that you could share that. If you're interested in seeing, I'll be happy to share it with you.
Yes, this is Wayne Petrolia. Would appreciate if you'd share that with us. Thank you.
You're welcome.
So I've got some hands raised here. We're at the top of the hour. I'm going to take them in the order in which they raised their hands. So Kevin?
Yeah, can you hear me?
We can.
Okay. I have a couple of questions. Number one was, there's some information out that says that a lot of countries, other countries are returning to school and having great success in how they're doing that. Are we looking at what they're doing in regards to how they're returning to school? Because they've been able to do so and basically had very negligible side effects or consequences for returning to school in regards to COVID. And then also, is there anyone that could speak to the responsibility for non-public schools in regards to any exemptions? I know that churches and religious organizations have been exempt in some cases in regards to guidelines. I'm asking this because I'm from a non-public school, and I realize that probably most people on here are from the public school sector, but we want to be responsible and adhere to the guidelines, but also want to know what your thought is in regards to non-public school requirements.
So in terms of the other countries, there are some excellent reviews and tables that show what they've done, and I have looked at those. One of the differences is that their country's control of the virus has been immensely better than ours. They have, limited their class sizes to 10 per class. Some of them have shut down the school if they have one case. That's in countries where they've really completely decimated the virus and, different things. But I am looking at some of those to see how they manage, return to school for sick children and things like that. But I'm happy to share those links because it is quite interesting to see how they have done, how they've done it. In regards to non-public or to private schools, per the roadmap, tribal and non-public schools must follow all the same rules in the roadmap as public schools. I'm not sure if that answers that question or not, but yeah, there is a statement in the roadmap that specifically says all the same rules apply to private and tribal schools.
There's a person in the with their hand up, John, no last name.
Yeah, that's me again, John from DeWitt. I know this will be hard for you to answer, but we're kind of getting some ping pong on this. We've got a band camp slated to start later this month, and a marching band of well over 100 students. And yesterday, our legal team from Chun Law Firm said, get advice on band and music programs from your health department. Mm-hmm. And so I attended this some are hoping for that. And I guess if you could reiterate what your suggestions are for how to proceed with some of these programs this summer would be.
So I'll give my opinion and Marcus can give his, and we'll see if they're the same.
Okay.
But
Okay.
I'm of the opinion that, kids do need to get back to some normalcy, but at the lowest risk that they can. With band, obviously there is some safety issues, especially with the wind instruments. I've not had the chance to read the recommendations put forth by the one organization I suggested. And so that I think would be one to look at. But especially if they can be outdoors, they can be distanced from each other, not pointing their instruments at each other. I support allowing kids to start doing those types of things in the safest manner possible, and screening them when they get there.
Yeah.
For symptoms, or just telling parents to not send them if they're sick.
Yeah, I have no reason to disagree with the doctor. John, I'll just say, we have received no training. I do not have a COVID community health educator on my staff. I laugh every time the governor says, ask your local health department, how you can grow wings and fly. We don't have anyone on our team who knows how to do that. So we're doing the best we can to help you. We feel like we're basically, about at the same level of knowledge as you are.
Okay. Okay.
And then the last hand I see is from Linda.
I can just tell you what we're doing with band. We are doing band outdoors with distancing, and we are following all of the athletic guidelines. So we're testing our kids, we're cleaning everything. So everything that we're doing for our athletes, we're doing for our band members that are doing summer band, and it's all outside. So that's how we're handling that. My question was, is there any merit to holding off and starting school after Labor Day, giving this a little bit of time, knowing that we're seeing some increase, or does it not really matter?
I think that would be your personal preference if it gives you more time to educate people and get your school set up. We see with those holiday weekends, a lot of people, especially that one will be kind of the last hurrah. People will go up north, they'll go to the beach, they'll have lots of exposures. And so you might see more cases about 5 to 7 days after that weekend. We've kind of seen that with the 4th of July. So just to be aware that that kind of thing happens. But waiting until after that point, again, I think realistically, you guys have not been given much time to get ready for this. So if having that extra time to get ready helps, I'm all for it. As a parent, I always thought it was nice to start after Labor Day because it's hard to have that little bit of school and then be off again. So I always thought that was nice. But I think the more time you have to get ready, the better. But from a disease standpoint, I don't think it matters. And again, I think Labor Day might be a weekend where you have more exposures, and it's just gonna, it is what it is, and we're just gonna have to roll with it, and it's gonna be okay. We're gonna get through it.
Okay, I don't see any more hands. Last chance for questions. We will be posting the recording of this on our website. It's going to take a few hours. It takes a couple hours for the system we use to process the recording. It'll get up there. The long version of Dr. Morse's PowerPoint will go there, and we will email it out to you. Dr. Morse, any last word?
I don't think so. On the PowerPoint we'll send out, the last slide has my cell number, my email, Marcus's office number, and his email. Hopefully he's okay with that. But if you have any questions or anything, just shoot them my way and I'll do the best I can to help you out. And I'll be sending anything new I come across as well.
And I just want to thank you guys for what you're doing for our kids. I know you didn't sign up for this, and I know this work makes us feel really heartsick, and it's very hard, and a lot of us are like ready for a new job. That's how we're all feeling, but bless you for the work that you're doing. Thank you so much.
Thank you, Marcus and Dr. Morse.
Hang in there.
Thank you.
Thank you.
Bye-bye.